Think about a family you know, or maybe your own family, a son or daughter who studied hard, passed their exams, graduated. Maybe they became a doctor, maybe an engineer, maybe a software developer, and then they left. Not because they stopped loving Nigeria, not because they did not want to stay, but because Nigeria never built the conditions that would have made staying worth it. The Five-Star Movement believes that every time a brilliant Nigerian boards that plane and jackpass, it is not a personal choice, it is a national failure. And it is a failure we are going to fix. Here's the honest picture of where Nigeria stands. Nigeria spends less than 10% of its national budget on education. The global recommendation is at least 20%. It spends around 5% on healthcare. The target we signed up to, the Abuja Declaration, requires 15%. The result of those choices is visible in one number. A child born in Nigeria today will reach only 36% of their potential, not because of anything wrong with that child, because of what the system fails to give them. More than 93% of Nigerian medical students say they plan to leave the country the moment they graduate, not because they do not love Nigeria, because Nigeria has not given them a salary they can live on, a hospital they can work in with dignity, a system that values what they have spent years training to do. Our technical colleges, which once built the practical backbone of this economy, are empty and broken. Our teachers are underpaid and overlooked. This is not a talent crisis. Nigeria is full of talents. This is an investment crisis. And the Five-Star Movement has a plan to end it. The Five-Star Movement human capital mandate is built on 5 pillars. Let me walk you through them. First, we make investing in people the law. FSM will push for a constitutional rule. We call it the 25-15 rule, requiring every level of government to spend at least 25% of its budget on education and 15% on healthcare. Not a guideline, not a promise that disappears after the election. A law with real consequences for any government that falls short. Because what is written into a constitution is harder to ignore than what is written into a speech. Second, we give our best people a reason to stay. Competitive, inflation-proof salaries for doctors, nurses, and teachers. Guaranteed placement for medical graduates so that training in Nigeria leads to a career in Nigeria. And tech zones, special economic areas with 24-hour power and high-speed internet where Nigerian tech professionals can work for international companies while living and building their lives right here in Nigeria. The Japa crisis is not inevitable. It is the predictable result of a system that never competed for its own people. FSM will compete. Third, we rebuild schools that teach real skills. Nigeria's 100 plus federal technical colleges will be transformed into innovation hubs, training Nigerians in artificial intelligence, renewable energy, advanced manufacturing, and digital technology. Every university course will be required to include at least 30% practical industry-led training because a certificate without capability is not an education. It is a broken promise. Fourth, we protect every child from the very beginning of their life. The science is clear. The first 1,000 days of a child's life from conception to their second birthday determine more of their cognitive development than any other period. What happens in those days cannot be undone by the best schools in the world. FSM's first 1,000 days initiative will provide free antenatal care, nutritional support, and early childhood development programs for every pregnant woman and every child under 2 in Nigeria. Not for those who can afford a private clinic, for every Nigerian. Fifth, we bring healthcare to where people actually live. World-level primary health clinics, solar-powered, properly equipped, staffed, connected by telemedicine to a specialist hospital in the cities, so that a mother in rural Kebbi can access the same quality of consultation as a mother in Lagos. And the National Health Insurance Scheme expanded to cover 90% of all Nigerians with a strong focus on preventive care because keeping people healthy costs far less than treating them when they are sick. And finally, Nigeria must become a country that creates knowledge, not just consumes it. 1% of GDP into a national research fund, university independence to attract global partnership, strong intellectual property protection so that when a Nigerian invests something, the benefit stays in Nigeria. I want to tell you what Nigeria looks like when this mandate works. A young woman graduates from medical school in Ibadan. She's offered a job in the United Kingdom. She considers it. Of course, she does. But the hospital in her city has the equipment she needs. Her salary keeps pace with the cost of living. She has a residency placement, a career path, a reason to stay. So she stays. Her patient in Ibadan, who would have waited years for a specialist, do not wait. A child in Nasarawa is born to a mother who received proper antenatal care. She was not one of the 500 women in every 1,000 who do not survive childbirth. That child grows up in a community where the primary health clinic is open, staffed, and connected to a specialist in Abuja by a screen and a solar panel. A boy from a technical college in Kano is trained in renewable energy systems. He is hired at 18. He earns, he builds a life. He does not need to live to find one. This is not a dream. This is what happens when a country decides to invest in its people, the way it has always invested in oil. The five-star movement is asking for your engagement with this idea. Our full human capital development mandates, every proposal, every mechanism, every constitutional commitment is published at fivestar.ng. Read it, share it, and I invite you to join us.